So, good morning class. My name is Nino G. Tamaro from Bachelor of Secondary Education, major in Science. So, for today's video, I will be discussing the three types of parasites. First is the Trichomonas vaginalis, second is the Trichuris trichuria, and third is the Trypanosoma brucei, including its morphology, classification, life cycle, epidemiology, transmission, pathogenesis, diagnosis, symptoms, preventions, and treatment. So let's start. So now let's start with Trichomonas vaginalis. For its morphology, Trichomonas has a length of around 10 micrometer and usually shaped like pear. It has 4 flagella on its front end and usually distinguished by closely related organisms with several previous flagella. The parabasal bodies, kinetosome, and Golgi stacks are the foundation of these flagellas. The pelta is a sheet of flagellary-based microtubules. The axostyle behind the pelta is a bundle of microtubules that stretches all the way from the front end of the organism to the reverse end. Near the pelta and axostyle of the nucleus is the Trichomonas, according to Smith 2021. For its classification, domain is Eukarya, kingdom Protista, phylum Metamonada, class is Parabasilla, family is Trichomonadida, genus is Trichomonas, species is Trichomonas vaginalis. So next is the life cycle of the species. Trichomonas vaginalis resides in the female lower genital tract and the male urethra and prostate. As you can see in the picture, where it replicates by binary fission, the parasite does not appear to have a cis form and does not survive well in the external environment. Trichomonas vaginalis is transmitted among humans or its only known host primarily by sexual intercourse. So for the epidemiology, in the United States, there were an estimated 2.6 million trichomoniasis infections in 2018. Trichomoniasis can increase the risk of getting or spreading HIV, and pregnant women with the infection are more likely to have their babies too early, or what we call the preterm delivery, and with a low birth weight, according to Center for Disease Control and Prevention. Next is transmission. The parasites passes from infected person to uninfected person during sex. In the woman, the most commonly infected part of the body is the lower genital tract, vulva, vagina, cervix, or urethra. In men, the most commonly infected body part is the inside of the penis or the urethra. During sex, the parasites usually spread from a penis to a vagina, or from a vagina to penis. It can also spread from a vagina to another vagina. It is common for the parasite to infect other body parts like the hands, mouth, or anus. It's unclear why some people with the infection get symptoms while others do not. It probably depends on factors like person's age and overall health. Infected person or people with symptoms can still pass the infection to others, according to Center for Disease Control and Prevention. So, ibig sabihin, nakukuha natin ang uri ng parasite na ganito sa pamagitan ng pakikipagtalik. Maaring sa lalaki sa babae at babae sa lalaki, or pwedeng ring babae sa babae. At ito ay madalas makita sa parte ng babae sa kanyang vulva, vagina, cervix, or urethra. Samantalang sa lalaki, ito lamang ay makikita sa urethra. So next is the pathogenesis. The parasite Trichomonas vaginalis or TB causes a highly prevalent sexually transmitted infection. As an extracellular pathogen, the parasites mediates adherence to epithelial cells to colonize the human host. In addition, the parasite interfaces with the host immune system and the vaginal microbiota, according to Center for Disease Control and Prevention. For its diagnosis, a sample of vaginal fluid for women or urine for males under a microscope for trichomoniasis can be diagnosed. No additional tests are required if the parasite is spotted under the microscope. Testing termed quick antigenic test and nucleic acid amplifier be employed in this test is not conclusive, according to Mayo Clinic. Next is the symptoms. The most common symptoms among people with vaginas are vaginal discharge, which can be white, gray, yellow, or green, and usually frothy with an unpleasant smell. So, ibig sabihin kapag yung amoy ng ari ng isang babae or ng lalaki ay hindi na kagaya ng normal na amoy ng isang babae, ng ari ng isang babae. So, next is vaginal spotting or bleeding. Yun nga, yung pagdudugo. Genital burning or itching. Yung feeling mo parang mahapdi at tawag dito, nakakairita. So, genital redness or swelling. Urge to urinate during urination or sexual intercourse. The most common symptoms in the people with penises are, ito naman yung sa mga lalaki. Discharge from the urethra, burning during urination or after ejaculation. Yung masakit siya habang umiihi ka or pagkatapos mo mag-ejaculate. And an urge to urinate frequently, according to Arkilia 2020. Next is the prevention. Ito yung para maiwasan o para hindi tayo magkaroon ng ganitong sakit. Every time you have vaginal or anal intercourse, wear condoms, male or female. If you are woman, and rub your vulva with the vulva of your woman's partner if you have oral sex. Cover the penis with a condom or female genitals with latex or polyurethane square. One of you should cover a dam with your genitals, according to Mayo Clinic. Next is for treatment. Trichomoniasis can be treated with single dosage of prescription antibiotic tablets like metronidazole or the tinidazole. This medicine is safe to use while pregnant. So, ibig sabihin itong metronidazole or tinidazole is safe siya gamitin kahit yung babae ay nagdadalang tao. Some persons who consume alcohol with 24 hours of taking this antibiotic may experience unpleasant side effects. So, ibig sabihin kapag nakainom ka ng alak o may alak yung katawan mo sa loob ng 24 oras at uminom ka ng ganitong uri ng gamot ay normal na makaranas ka ng side effects. Trichomoniasis can resurface in those who have previously been treated for it. Within 3 months of therapy, almost 1 of every 5 patients become infected again. So, ibig sabihin, yung iba, kapag nagpa-test sila tapos uminom sila ng gamot, wala pang 3 buwan, nagiging infected na ulit sila. To avoid reinfection, so yun nga, para maiwasan natin yung ma-infect ulit, make sure that all your sex partners are treated as well and refrain from having intercourse until of your symptoms have gone away. About a week, sabi dito, sa loob ng 1 linggo dapat nawala na yung simptomas mo. If your symptoms reappear, be tested again, according to MSDS Online. So, this is my references. So now let's move on to the second parasite, Trichuris trichuria. For its morphology, Trichuris trichuria adult males are 30 to 45 millimeters long. May haba siyang 30 to 45 millimeters. With a coiled tail, adult females have a straight posterior and 35 to 50 millimeters long. The anterior end of both sexes is long and whip-like. Adults live in the host large intestine, cecum, appendix, according to Center for Disease Control and Prevention. So, madalas makita itong Trichuris trichuria sa ating intestine, cecum, and appendix. So, for its classification, order is Trichocephalida, kingdom is Animalia, phylum is Nematoda, class is Enoplea, family is Trichocephalida, genus is Trichuris, species is T. trichuria. So next is the life cycle of the species. So as you can see on the picture, the unembryonated eggs are excreted in the feces. The eggs grow into a two-cell stage in the soil. The nodes are more advanced level of cleavage, and then they develop into embryos. Infected eggs take 15 to 30 days to hatch. So, ibig sabihin, yung itlog, bago siya mapisa ay kailangan niya ng 15 to 30 days. The egg hatch in the small intestine after ingestion. Soil contaminated or hands or food, and released larvae, the colony matures and establishes itself as an adult. Adult worms reside in the cecum and ascending colon, measuring around 4 centimeters in length. The anterior parts of the adult worms are threaded into the mucosa and they are anchored there. So, ibig sabihin, itong uri ng itong Trichuris trichuria ay madalas makita sa ating intestine. Nakukuha ito sa pamamagitan ng pagkain o kaya sa ating kamay na naisusubog gamit ang ating bibig. Next is the epidemiology. For its epidemiology, whipworm is the third most prevalent roundworm in humans. It's a soil-transmitted helminth, STH. Whipworm produces the infection trichuriasis, which is common in regions where humans' excrement is used as fertilizer or people defecate on the ground. The worms are transmitted from person to person by feces-contaminated food or feces oral transmission, according to Center for Disease Control and Prevention. Yun na nga, gaya ng sabi ko, maaari itong makuha sa pagkain, sa lupa. Sabi nga ng mga nanay natin na dati, wag daw tayong magpapaa kasi papasok yung bulati sa kuko natin. So, kahit nasabi natin hindi siya nakapasok totally, napupunta siya sa kamay natin na maaari natin maisubo at makapasok sa pamamagitan ng ating bibig. So, next is the transmission. The worm is acquired through fecal oral transmission. A human host consumes infected eggs, typically while eating food. Ayun, gagaya nga ng sinabi ko sa pagkain. Once the embryonated eggs are ingested, the larvae hatch in the small intestine. From there migrate to the large intestine, where the anterior ends lodge within the mucosa, according to Viswanath et al. 2021. So, mula siya sa small intestine, papunta sa large intestine. So, next is the pathogenesis. The worm is spread through the feces to oral transfer. Infected eggs are consumed by a human host, usually when eating food. The larvae hatch in the small intestine after the embryonated eggs are consumed. The anterior ends of the worms move to the large intestine. Cells are destroyed and the host immune system is activated, attracting eosinophils, lymphocytes, and plasma cells. Rectal bleeding and stomach discomfort are common signs of this condition. The parasites generally settles in the ileum and cecum at the end of the intestine. The worm may infest the whole colon and rectum in certain people. Without food, the worm may live for up to 4 years, according to Viswanath et al. 2021. So kahit na wala siyang nakakain ay kaya niyang mabuhay sa loob ng 4 na taon. So sa diagnosis, the standard method for diagnosing the presence of whipworm is by microscopically identifying whipworm eggs in a stool sample. Because eggs may be difficult to find in light infection, a concentration procedure is recommended, according to Center for Disease and Control and Prevention. Next is the symptoms. The patients with heavy infection may have abdominal pain, yung pananakit ng tiyan, anorexia and diarrhea, pagtatae, weight loss o yung pagbaba ng ating timbang. Anemia and rectal prolapse may result particularly in children, according to Person 2020, yung pagbaba ng ating dugo. So, next is the prevention. So, paano nga ba natin maiiwasan ang pagkakaroon ng ganitong sakit? Prevention of trichuriasis is possible through effective sewage disposal system, sanitary food preparation, avoidance of potentially contaminated water, and good personal hygiene including hand washing. According to Person 2021. So yun na nga, number 1 is yung paghuhugas ng kamay, malinis yung ating kinakain, naluluto ng maigi para may potential na mamatay yung uri ng bulate o ng kahit na anong bakterya na nahalo sa ating pagkain. So next is treatment. Paano nga ba natin magagamot ito? So magandang balita dahil nagagamot siya. Mebendazole 100 mg orally twice a day for 3 days is effective for patients with trichoriasis. So inom ka ng mebendazole 100 mg orally 2 beses sa isang araw sa loob ng 3 araw. A single dose mebendazole 500 mg has been used in mass treatment programs. Also effective for individual patients is albendazole 400 mg orally once a day for 3 days. So yun nga, ito namang mebendazole 500 mg, isang beses lang siya isang araw sa loob ng 3 araw. Invermectin o 200 mg din siya orally once a day for 3 days. Isang beses din siya sa loob ng 3 araw. This drug should usually not be used during pregnancy. So, ibig sabihin, kapag ikaw ay nagdadalang tao, ay bawal kang uminom ng ganitong uri ng gamot. If treatment is ivermectin is planned, patients should be assessed for co-infection with loa-loa if they have been in areas of Central Africa where it is transmitted. Ivermectin can induce severe reactions in patients with high levels of loa-loa microfilariae, according to Person 2020. So, next is the reference. So as you can see on my reference, you can use this to search in internet to deepen more your understanding about trichoria. So now let's move on to the last parasite, the Trypanosoma brucei, T. gambins, and T. rhodesiensis. So for its morphology, invertebrate host, the parasites develops trypomastigotes but in insect vectors. It forms epimastigotes, plemorphic trypomastigotes with posterior kinetoplast and long undulating membrane. Range in length from 16 to 42 meters. So may haba itong 16 to 42 meters. So medyo may kalakihan siya. And bred with 1 to 3 meters. They come into varieties. Along it, slender dividing forms with long free flagellum and stumpy non-dividing infective or damita-cyclic forms with no free flagellum. The epimastigotes with anterior kinetoplast and short undulating membrane vary in size from 10 to 35 meter long by 1 to 3 meter wide, according to Center for Disease Control and Prevention. So for its classification, order is Trichocephalida, kingdom Animalia, phylum Nematoda, class is Enoplea, family is Trichocephalida, genus is Trichuris, species is Trichuria. Next is the life cycle of the species. So for the life cycle of the species, as you can see in the picture, the life cycle of Trypanosoma cruzi involves 2 intermediate hosts, the invertebrate vector or the triatomine insects and the vertebrate host or the humans, and has 3 developmental stages, namely trypomastigotes, amastigotes, and epimastigotes. So next is the epidemiology. TB gambins is endemic in Western and Central Africa, while TB rhodesiensis is restricted to Eastern and Southern Africa. The ranges do not overlap except in Uganda, where both subspecies are co-endemic with TB gambins in the northwest corner of the country along the borders with South Sudan and Democratic Republic of Congo, and TB rhodesiensis mostly clustered in the center of the country, according to Center for Disease Control and Prevention. Next is the transmission. Both forms of sleeping sickness are transmitted by the bite of the tsetse fly or the Glucina species. Tsetse flies inhabit rural areas living in the woodlands and thickets that do not East African savanna. In Central and West Africa, they live in the forests and vegetation along streams, according to Center for Disease Control and Prevention. Next is the pathogenesis. African trypanosomiasis is a human tropical parasitic disease usually caused by protozoan hemoflagellates belonging to the complex Trypanosoma brucei. A trypanosomal chancre develops on the site of inoculation. This is followed by a hemolymphatic stage with symptoms that include fever, lymphadenopathy, and pruritus, according to Gibson and Almonacid. For its diagnosis, general laboratory studies may be helpful in diagnosis of African trypanosomiasis or the sleeping sickness. A definitive diagnosis of TB infection requires actual detection of trypanosomes in blood, lymph nodes, cerebrospinal fluid, or the CSF, skin chancre aspirates, or bone marrow, according to Hanaide and Chandrasekhar 2019. Next is for symptoms. Fever, severe headaches, irritability, extreme fatigue, swollen lymph nodes, and aching muscle and joints are common symptoms of sleeping sickness. So, kapag meron kang sleeping sickness, ang madalas mong maranasan o maramdaman ay ang lagnat, yung sobrang pananakit ng ulo, irritable at saka yung extreme fatigue. And aching muscle and joints are commonly symptoms of sleeping sickness. Yun, kasama na rin yung pananakit ng katawan. Some people develop a skin rash o yung rashes natin o yung pamumula sa balat. Progressive confusion, personality changes, and other neurologic problems occur after infection has invaded the central nervous system, according to Center for Disease Control and Prevention. For its prevention, how can I prevent African trypanosomiasis and prevent other insect bites? So tayo, paano nga ba natin maiwasan yung pagkakaroon ng trypanosomiasis at yung iba pang kagat ng insekto? So ito ang dapat nating gawin. Wear protective clothing including long sleeve shirts and pants para maiwasan nating makagat. Wear neutral colored clothing. Inspect vehicle for tsetse flies before entering. Yun nga, sa mga may sasakyan, bago tayo pumasok ng sasakyan, kailangan muna natin i-check kung merong iba't ibang uri ng insekto na nasa loob ng ating sasakyan. Avoid bushes, use insect repellent, and according to Center for Disease Control and Prevention. So, for treatment, Gambian's infection is available in the United States. The other drugs or Suramen melarsoprol, eflornithine, and nifortimox when used in combination with effortinin, used to treat African trypanosomiasis, are not commercially available in the United States, but we can obtain this from CDC or Center for Disease Control and Prevention. So next is the references. So that's all for today. Thank you for watching and have a good day.